We know that teeth tend to tip into extraction space with fixed braces. That's why we don't close space in round wires. We wait till we are in rectangular wires to close the space. But teeth also tend to tip into extraction space with aligners. So what does this mean for us as a clinician? We need root control attachments for bodily translation of teeth to prevent the tipping. But the software doesn't always give us a root control attachment. Sometimes my digital plan comes back and there's a deep bite attachment in an extraction case. I'm like, no, 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 I don't want a deep bite attachment. I need a root control attachment. So if that happens, we really need to, change the deep bite or rotation attachments for root control attachments that we need to bodily translate the teeth. The other way to manage root inclinations, and you mentioned that earlier, is the control of the inclination of the canine when we close the space. We want to stage the extraction space closure to maintain this mesial crown tip of the canine as the extraction space closed. And then in the final occlusion, we want to build in a 15-degree virtual gable bend across the extraction site. So what is the clinical implication? If some of you are online and you are not really comfortable treating extraction cases with aligners, you can consider a hybrid treatment. I think hybrid treatment is the way of the future, right? So you can close your extraction space, and then if you find your roots have tipped, you can add 2 or 3 small brackets or root helpers to upright the roots and get parallel roots before you scan additional aligners.